Let me put on this one. Okay, it's moving in my mouse. Okay, let me start. Good morning, everyone. And as you can see, the name is Josephine. I'm a very happy member of Forever Living Products. And today, the topic for today is, as you can see, understanding prevention and management of blood pressure. It's a part one because, again, I'm only going to be dealing with high blood pressure today because that's the most common of the two types of when we're talking about blood pressure. So it's part one. That's I'm focusing on, because of time, I'm only going to be focusing on high blood pressure. So as you can see, let's move forward. Okay, first of all, let's talk about the function of the blood. And when we're talking about, because when we're talking about blood pressure, it is connected with obviously good circulation of blood. Okay, you can see the function of the blood. When we talk about the blood, is super able to deliver nutrients. Very, very important function for the blood. Oxygen and hormones to various organs in human bodies. So it helps to deliver white blood cells, which are very responsible for immunity, and also at the same time very, very effective, the white blood cells, for when we talk about detoxification. So what do you mean by high blood pressure, which is also referred to hypertension? According to research, it's a silent killer. It is really a silent killer because it doesn't give you any warning or symptoms until stroke or heart attack occurs. So what are the major risk factors? The major risk factor can double the risk of heart attack and stroke. And this invariably increases the risk of kidney failure because they are all interconnected, loss of eyesight, and when we're talking about Alzheimer's disease, which is a form of dementia, which is on the increase, can also be associated with dementia, with the Alzheimer's disease. So a sustained elevation of blood pressure above is, you can see, I'm showing the picture here. I hope you'll be able to follow this picture. It's self-explanatory. So the first example by blood on the walls of the arteries. This is what they are. So when we're talking about blood pressure in reality, there are two readings. There's one which is called systolic, which is the top. Okay, systolic is the top one. And this means the pulse of each heartbeat. And the bottom reading, which is we call it as diastolic, okay, you can see also there is the pulse in between when the heart beats and when the heart relaxes. That's at rest in between the beats. So that's what we mean by diastolic pressure, which is the bottom reading, and systolic pressure, blood pressure is the top one. I'm sure many of you have seen it, you're familiar with it. Okay, so those are the two readings. This one also explains it more. So so normal blood pressure, as you can see, is below 120. That's for the systolic, and diastolic one is below 80. That's according to research. That's the normal blood pressure. Okay, but when it's elevated, this can range from 120, the systolic, to 129. Okay, between. And the diastolic can be still below 80. Okay, so this was a recent one. That's changes in recording high blood pressure. So they've now put them, classify them according to the stage. So the stage one is when the blood pressure is 130, between 130 and 139. That's the systolic one. And then you find, you find the diastolic is between 80 and 89. So that's the stage two. This is getting serious now. And then now that's where there's crisis, really real crisis. They call it hypertensive crisis. Can you imagine? There are some people, I said, they are walking, actually walking dead. And some people, they are walking around, high blood pressure. I mean, the reading is above. You can see that here, the systolic is that, and the diastolic is now. Okay, which is crisis. By this time, they're already, God forbid, in intensive care. So it's all there for you. And let me move on. Okay, so this is how to take the blood pressure reading. This is what is done. For me, I normally take 3 readings, and then I take the average. So when you're taking blood pressure with the blood pressure monitor, this is the gadget, one of the gadgets for measuring blood pressure. When you're taking it, you really have to make sure that the patient or the person is sitting in a very quiet place, no distraction, and they are relaxed, and this is the proper angle. Can you see that? Okay, so it's very, very important. So the left arm must be at rest, and the arm elevated to the heart, very, very important. So you have to make sure that the person is really, really relaxed. You can talk to them initially, because some people, there's what you call a white coat syndrome. As soon as, let's say it's an hospital establishment, as soon as they see a doctor in a lab coat, in a white coat, the blood pressure increases. So you just have to try and calm the person down if it's taken in a hospital environment. So this is let's see, this is about what is happening now. Because of economic situation, not only in Kenya, globally, many people are stressed, and according to research, stress can damage arteries, okay, the big blood vessels, triggering heart attacks and stroke. So many, it's not only guys, also women. Although I just put a picture from a man here, they are so stressed, and stress is a known factor for increase in blood pressure. So let us go through quickly what are the main causes of high blood pressure. If somebody is obese, obesity is a very serious factor. Yeah, because you are carrying a lot of weight, and you are causing, when you are carrying a lot of excess weight, that's a problem for the heart. The heart is now it's pumping higher than before, hence increase in blood pressure. And again, if you are sitting all the time, you don't exercise, we call it sedentary lifestyle. Also, it's not good, because you need to do everything in moderation. And you can see not exercising can reduce the production of nitric oxide, which we're going to be talking about later. So another cause of high blood pressure is a genetic connection. So it runs in a family. So this is I have witnessed, and whenever I'm talking to a patient, I normally ask so many questions. I have questionnaires that I give to them then I'll be ticking with them as I'm going through during consultation. So to find out, so I don't miss anything. So you find that people also, apart from obesity and many other reasons, there's a genetic factor associated with high blood pressure. Age, again, getting old is quite understandable. If the heart has been beating from 3 months up to, you are now in your 70s, it's been doing a lot of work over the years. So it is understandable that increase in age can cause increase in blood pressure, because of the amount of work is done over the years, especially again depending on the lifestyle of the person. Okay, so race is also associated, and again from my research, I found that many people, black people, there's some connection with high blood pressure among black people, unlike other races. Again, maybe due to social and economic factors. When you go down to it, that's also, that could be an association with the increase in high blood pressure among black people, or social disadvantages in many cases. Yeah, so obviously another one, you can see alcohol consumption, which is on the increase nowadays, especially with the economic situation. I live near Kiambu Road, and if you look at Kiambu, Kiambu Road recently over the past, even over within the last 2 years, that road is littered with alcohol shops, open left and right, because many people they find solace in taking alcohol. So alcohol, which is also we know as an oxidant, can cause increase in blood pressure. And taking too much caffeine also, because you can see caffeine stimulate adrenaline, which is adrenal glands on top of the kidneys, so it's poor. Increases the heart rate, like you see a tiger coming. Okay, so adrenaline is released, and when you are taking something like caffeine on a regular basis, some people can even take six cups of coffee a day, not even to talk about other beverages containing caffeine. So that's also be associated with increase in the blood pressure. And those people also, there's an element of, as you can be seen later, of medication like Lasix, which is a diuretic. And don't forget also, something like caffeine is also diuretic, and depleting the amount of calcium, potassium, magnesium, and the B vitamins. All these things can cause increase in blood pressure because these are not a deficiency of the micronutrients. So smoking is known to cause inflammation. It's a well-known factor for increased blood pressure. Diet, that's when you a king or queen of this junk food on the high street, because when you consume this type of food on regular basis, it increases this hormone called cortisol, and cortisol is a known factor for increase in blood pressure. Too much salt, okay? Some people, they eat so much salt, and salt is a known factor also at the end of the day that can cause increase in the blood pressure. Not even to talk about this one, monosodium glutamate. Those food enhancers. You see them in the red container with green top. So according to research, also adding this to food can, apart from affecting memory, can also cause increase in blood pressure. So those are all the things. Too much carbohydrates. This is also known to cause increase in that hormone cortisol, and insulin. Insulin, is produced by the pancreas, which is also, as deficiency can be associated with the diabetes. Now, there's a connection between, let me remind you, there's a connection between diabetes and high blood pressure. The two, they have to go together. So, and food allergens, all these people, they are prone to all these allergens in the food, and this is not to increase that hormone on top of the kidneys, adrenal, the hormone is called adrenaline. So it can cause increase in blood pressure. Stress, we've already mentioned about stress with the picture of that guy. When you are stressed, you can't sleep. You suffer from sleep apnea. Okay, although the sleep apnea also is associated with obesity. When people are obese, they also suffer from sleep apnea because of too much weight. So apart from its connection with stress, it causes increase in blood pressure. People are working shift work. This is why in my early career, in my family, I have so many people who are nurses. Okay, so when I saw the lifestyle at the initial stage of nursing, I decided, no, I'm not going to work as a nurse, because part of the job involves, especially during the early days, or when the part of the program involves working day shifts, night and all that. So according to research, found that shift workers, they are known to have increase in blood pressure, because they are not working the way God made it, the way in God's way. That's when people should be sleeping. So in effect, you find that this by working at these odd hours, it affects the blood pressure, it affects the circadian rhythm. So we have mentioned about medication, and medication is another factor for increasing blood pressure. Remember, medication, they are drugs, they have catalog of side effects. Go, just imagine the common aspirin, okay? It's been regular consumption can cause damage to the kidneys, and not even to talk about antacids as well. You know, anything that affects the kidneys is going to also affect the blood pressure, because there's a connection, the function of the kidney and the blood pressure. So this is what they dish out like sweet in this country, antacid. Many people, they suffer from acidity. Therefore, they prescribe also antacids, those medication to control acidity, like proton inhibitors and all that. So they are known to actually deplete, to cause a depletion of macronutrients like the B vitamins, B12, magnesium. You can see all this, even birth control. That's magnesium, calcium. I'm just shortening it to make it for to speed up the process. Birth control pills is also known. People on birth control pills, they're also known to be prone to increase in blood pressure. Not even to talk about those who are drinking, they say, chaga, whatever we call it, those illicit brews and other drugs. So causing increase in blood pressure. If that's if the hormones, which I said is from the adrenal gland on top of the kidneys, if they are not working properly, can cause increase in can cause a chronic excess stress. Okay, and obviously it's increase in blood pressure. Now, this is what you do whenever somebody said they are hypertensive. These are the things I always ask about their thyroid gland, whether they are at the checkup, because the thyroid gland, when it's not working properly due to increase in, they call it hypothyroidism, in the function of the thyroid gland, these people, they are known to be hypertensive. So, as you said, maybe due to inability to monitor, again, apart from that, they are medication. So maybe they're not taking their medication for they are not taking their medication properly, as you can see there. And yes, so people, the people who are hyperthyroid, suffer from hyperthyroidism, to repeat again, they are known to have issue with increase in blood pressure. And again, the other way, if the thyroid gland is not functioning well, you find that also we call it hypothyroidism. You know, the thyroid gland is very, very important for so many functions. Okay, so now we're talking about the blood pressure here. So if it's not functioning properly, and their medication, let's say they are not monitoring their medication properly, that can also have an effect of increasing blood pressure, because they're not taking the medication to control it. So here, the kidney disease, and people who have been diagnosed with kidney disease, the importance of the kidney is to control both sodium and calcium. So that's another factor. Increase in blood sugar can damage the eyes, as you'll be seeing later. So the kidney is also involved, and the kidney is where and also the kidney, this associated kidney disease, people have been diagnosed with kidney disease, where the blood vessels are damaged, and once they're damaged, they become narrow. You will see, you have better understanding in the slide coming. So this is another one. This is a medical terminology. I used to deal with this, work in pathology. So they call it pheochromocytoma. Basically, it's to do with the hormone. It grows in the hormone, which can also be malignant, can be cancerous. So when they've been diagnosed with this, you find that the blood pressure is always high. So this, according to research, it is can go in 3 to 13% cases of those who have been diagnosed with this condition, pheochromocytoma. So let me move on. High blood pressure, diabetes, I know, 60% of, as I said, there's a connection between high blood pressure and diabetes. So 60% of diabetic people, they are hypertensive. So if somebody tells me they're hypertensive, I always ask, are you checking your blood sugar properly? Are you diabetic? You have to keep on digging in, because you find that most of the time people, they are not open. So this is from my experience. So before they actually say, oh yeah, they're also diabetic, I said, no wonder you're also hypertensive. We've already mentioned about obesity, not enough sunshine. Oh well, that's the connection according to my research. We've already saw that oxygen deprivation to the brain. This is a deadly one. Okay, so this is what they normally monitor in hospital as well, making sure that the oxygen level when the patient is admitted is running very well. So we've already mentioned that. I mentioned inflammation. Inflammation here, it could be due to being exposed to environmental toxins like heavy metals. And again, you can see there, I'll be showing the picture later, increase in the plaque formation in the arteries. Plaque are just like they're fat, like fat deposit. Okay. And sometimes you can get clot, you can get clot building up to forming part of the plaque, apart from the fatty deposit. It's really, really, I'm not talking from real, when you see something, you've been dealing with something for many years, when they say plaque, I can see the picture straight away. Not because of my previous experience. So sometimes when you get that plaque inside the arteries, which this is being also associated with inflammation, you find that sometimes also you get a calcification. So this plaque, they call it atherosclerosis in medically, can break, can break up, which is very serious. Can break up, causing stroke due to blockage in the blood vessels. They can break out into small. This is why they're always on the word junior aspirin. Okay, so smoking, we know, we've already mentioned about smoking. Okay, all right, and what else do I have to say there? Okay, we already mentioned. Oh, sorry, something is happening here. All right, right, because the kidney, we've already mentioned about this without repeating. If something's gone wrong, damage to the kidneys. Okay, they say glomerulonephritis. That's the inflammation of the filtering part of the kidneys. Okay, damage to those tiny filters inside the kidneys. All right, it's a known factor. We've already mentioned about the blockage of the arteries to supply blood to the kidneys. Oh, this is one, and no, due to aging process, this is enlargement of the heart. Due to aging process, you find that some people are being diagnosed with enlargement of the heart. Okay, I can tell you, my mother was diagnosed with this for some years, but because of Forever Living products, she was able to manage it. And the doctors, they were very surprised that she's not on conventional medication, and the heart is no longer enlarged as before. Okay, so that's using the Forever Living products like Cardio Health and many other supplements through Forever. So we'll be talking more about that later. So this is to do, we've already mentioned about that. So this is another one I did not mention. This is to do with, they call it another condition called Cushing's syndrome. It's it's a medical condition. Let me see if the picture is below. This is the picture now. Yeah, I'm sure you've seen some people who are looking like this. They call it Cushing syndrome. These are prone to increase in blood pressure. You can see you can see the features. Somebody who's been diagnosed with the Cushing syndrome. So they say maybe it's being associated with increase in blood pressure, and maybe caused by the exposure to too much cortisol, which is a hormone. Okay, for a long time, keep on this hormone, this cortisol hormone is terrible. It's just like when you're being faced with a lion. Obviously, you want to run. Okay, and in normal situation, you run and you get away from it. Then that hormone is no longer functioning. But some people, it's constantly there. So this is when you get increase in the cortisol all the time for a long time, you find that it can exhibit increase in the blood pressure. It's a terrible situation. All the time, I see we are being chased, like stress. The use of steroids. Some people they put them on steroids, and steroid is known to have a catalog of side effects like increasing blood pressure, apart from also causing reduction in your immunity. So I hope you are following. Okay, road rage. Hey, look at this. Hey, in Nairobi, this is now happening more and more. Little things trigger people. So many drivers on the road, they are not normal anymore. So when I'm driving, I'm always you don't tailgate, drive too close, because you don't know the person who's in front of you, as a driver, and little things, they get annoyed, short fuse. So this also, the people who are constantly on this mode of road rage, they are known to be hypertensive. Not to talk about, we've already talked about the aging process. So this is the aging process already mentioned, because then the blood vessel is not as flexible as when you were young, and that can put pressure on the system, which carries blood through the body. That might explain why can you imagine the statistic? 2 out of 3 adults over the age of 60 are known to have high blood pressure. Take note, okay? Especially for if the diet is being wrong, the lifestyle is not good, and with other reasons I already explained above. So apart from aging process, there are other reasons which may increase blood pressure. And you can see there, they say over the age of 60. So that's a delicate age. People over the age of 60, they have to be very, very watchful about their blood pressure. Now let's talk about micronutrients deficiency. That's, we call it the nutrition deficiency. Okay, obviously this is also dietary related. So if your diet is deficient of magnesium, which is very, very important, magnesium is a very important mineral for contraction and relaxation of the blood vessels. Very, very important. So these are all micronutrients. Calcium is also very important to relax the muscle mass in the blood vessel. And also, you can see muscle spasm to make sure to prevent muscle spasm, and which can happen due to reduction in nitric oxide. We'll be talking about the importance of nitric oxide later. Now you can see when we're talking about the blood, there must be a balance between potassium and sodium. So if the potassium is deficient, you're going to have increase blood pressure. And also these B vitamins, as I said, those people on antacid, most especially, apart from nutritional issue. Okay, iron deficiency, that's another one. People anemic. People are anemic for so many reasons, maybe which has not been looked at for a long time. Those are all the questions I ask. I always ask them, are you anemic? If you are, maybe you need to go for a blood test to find out maybe the blood pressure is related to deficiency of. And you can look at this protein, very, very important. Deficiency. The diet is wrong. They're eating a lot of carbohydrate without balancing it with protein. So, which can affect the amino acid here. The amino acid here called arginine, which is very, very important to dilate the blood vessels. Deficiency of antioxidants, okay, obviously is also associated with increase in blood pressure. Again, there's another one which I normally talk about. This is a CoQ10, which is produced by the mitochondria. Mitochondria is the energy part of the cell. So producing CoQ10 enzyme. Nowadays, you find that many people, they are having issue CoQ10 enzyme. In the field of nutrition, this is what is happening more and more regularly. So CoQ10 deficiency, you remember I said that this is related to mitochondria, the powerhouse of the cell. And you find that because people are on medication for cholesterol-lowering drugs like statins, there's so many of the Crestor, there's so many of different types under statins. They find, according to research, statin is still, any family of statins, they are known to deplete CoQ10 enzyme by between 50 to 60%. And again, if they are on diuretics like Lasix, this is the one they. Okay, let me go back again. People on medication for blood pressure, you find one of the side effects of the drugs for medication is they cause edema. That's the increase in fluid retention. So the only way to balance is to give them diuretic, water pill. And the water pill is known to cause the depletion of potassium. So when you get a deficiency of potassium, as already mentioned here, you're going to have issue with the blood pressure elevation. So I don't want to go because of time. I don't want to go into this. It's just high blood pressure and cholesterol. It's all to do with the cholesterol. No, they're giving cholesterol a bad name. No, we need cholesterol. Very, very important. The good one. It's the bad ones that we don't want. We don't want increasing the bad one, cholesterol, because those are be associated with a lot of medical challenges. All right. So now this is the artery here. You find that you have deposit of calcium, and you can do what I was saying, making the blood vessel very. It's very. It kinks up the blood vessels, deposit of calcium, and again, especially when you're taking calcium, you don't balance it with vitamin K2. So this is the blood. Those are the blood platelets or blood. Just like blood clot, basically in plain language. So those are the bad cholesterol. Imagine this is an artery. You can see now you get occlusion here. Okay, you find that it's not blocking, almost blocking the passage of blood. Can you imagine? So you can see the situation here. Cholesterol, yeah. You can see what is happening here. Therefore, the blood doesn't got enough room to pass. Hence, increase in blood pressure. Okay, so as you can see there, to make sure I remind myself, cholesterol is not always the culprit. It's not always the culprit for increase in blood pressure. What has been happening is inflammation. In most cases, it's also associated with increased blood pressure, inflammatory condition. And so it can predict development of increase in blood pressure. So it's always good to control inflammation or inflammatory response. Okay, what are the symptoms when we are talking about these arteries? Okay, you've seen it. You've seen that picture. What symptoms when the arteries, when the big blood vessel is clogged up with those plaque? Okay, or atherosclerosis, yeah. So because the blood is not able to flow, the blood pressure is persistently high. And again, people have been diagnosed with that, with the clogged arteries, they suffer constant migraine. So it's not, this is why you have to ask so many questions. Not only due to allergies, migraine, you have to ask about, that. Memory impairment, obviously, which is it's an obvious one. Chronic fatigue, all right? Your clogged artery, insomnia, not being able to sleep properly, intimate problems, okay? Like vision and hearing, this is all associated with the clogged arteries. And you can see here shortness of breath and pain in the chest, okay? These are the symptoms. Pale skin on the legs. This observation in some people. Which can also result in muscle and joint pain. So now let us go to statistics in Kenya. So this is a Kenya statistic, the top leading cause of death in Kenya. You can see there that you can see there. Okay, I went to where the familiar ground in UK, an estimated 40 million adults are living with high blood pressure. The figure that stays on the increase because of so many factors. Then now let's go back home here in Kenya. As you can see here, according to research, you find that in Kenya, 1 in 4 Kenyans actually living with high blood pressure. 1 in 4. So we are dealing with a serious issue here today. 1 in 4 Kenyans are living with high blood pressure. This was according to the research done by an organization called Stepwise. So in Kenya, is the fifth leading cause of death and the major factor for hospital admissions. So what could be the reason? Lack of awareness. Okay, we can say that because especially men, more than half of the population, they've never had their blood pressure measured. Can you imagine? Leading to a delay in diagnosis, poor treatment also, and control among those who have been diagnosed. Obviously, if they have not been taking their medication properly, also those can increase that statistic in Kenya. Again, cost of treatment. You have to think consultation, no, doctor's visit, test, medication. Many people they can't afford all this. Okay, and rehabilitation ranging. Now you can see all these things. So it can be cost of treatment can be up to 40K. I mean, nowadays with the economic situation of the country, not many people are able to afford this cost. So that's the statistic for Kenya for you here. Okay, this look, watch this.
Heart attacks, certain cancers, osteoporosis, diabetes. The major diseases of our society may be caused in part by what we eat. One of the physicians who helped me to understand why is Dr. Michael Clapper.
I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery for coronary artery bypass surgery in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, Mr. Phillips, did you eat before you came to the hospital tonight? He said, yes. I said, what did you have? He said, I had a cheeseburger and a milkshake. And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
This is a beautiful example of what atherosclerosis looks like. There it is. And I'm going to just gently tug on this now. I love it. It's a little hard to pull. That coupon, if you could give a little pull too. We'll see if we can get this thing out.
We are just holding our breath so that you will finish the case.
There it is.
Oh.
America's #1 killer right there before your eyes.
Okay. So that picture, that explains it all when we're talking about plaque formation inside the arteries. Although it's not only one, that guy is not only, now this is accumulation of bad diet over the years. So that's caused increase in formation of the plaque inside his arteries. Okay, I hope you understand. That video is giving me a better understanding of what is happening when we're talking about atherosclerosis. So those are the things. Now, when you talk about main complications of persistent increase in blood pressure, you can have this one that's affecting the retina, which is at the back of the eye. So can cause increase in blood pressure can affect the eyes. Okay, but you can see the brain as well can be affected, which can result in stroke if it's not monitored properly. And also diabetes related. This is where there's association between diabetes and increased blood pressure. Too much blood sugar levels, glucose level, can also be one of the persistent complications of high blood pressure. We've already mentioned about the kidneys as well. Okay. Chronic renal failure can be a resultant effect of chronic high blood pressure. Okay, before I mentioned about the heart as well, enlargement, the heart. Okay, these are all main complications of persistent increase in blood pressure. This is when we're talking about retina. Retina is at the back of the eye. You can see the eye is well supplied with a lot of blood. So this is also associated with people who are diabetic, called diabetic retinopathy. So it can cause blindness because if you increase the blood pressure all the time, this is what happens in those people who are having or diagnosed with diabetic retinopathy. So that's due to increase in blood pressure. That's hypertension of that area of that part of the heart, of the eyes. Okay, why should you okay, we've already mentioned about this. We mentioned about anemia. So this is just a revision for you. When somebody is anemic, because again, maybe due to deficiency of these B vitamins, they're very important. And inflammation, you mentioned about inflammation causing stroke because of the breakage in those plaques, which I showed you earlier on. We mentioned about stress nowadays. Emotion could be emotional or physical or chemical. So those are the associated with increased blood pressure. This is another one, like glycation. So this is to do with the irreversible binding of blood sugar, protein, okay, and fat. So when you get, when all these things, they're combined together, you can get formation of that bad plaque inside the arteries. You call it glycation. Sorry for that medical terminology. I know you understand. So this is another type of high blood pressure affecting people during pregnancy, and which occurs according to statistics between 8 to 10% of pregnant women. Okay, so this is during pregnancy. Okay, or no, also you can see if some people maybe before they getting pregnant, if they're already hypertensive. Okay, then you can have what you call pregnancy-induced hypertension. Okay, this occurs between 20 weeks 20 weeks of gestation. Okay, without when you test the urine, find that there's no protein in the urine, but the blood pressure is high. So this effect of the high blood pressure during pregnancy, okay, hypertension during pregnancy, can cause what you call a condition called preeclampsia. So preeclampsia, this is okay. In this case, it's in people they've been diagnosed with protein in the urine. Okay, when you do a urine test, preeclampsia is increase in blood pressure during pregnancy. So this one can actually make some women who have been diagnosed with this, pregnant women, they normally admit them so they don't go into labor. So they monitor them, they keep them under supervision. But after pregnancy, the blood pressure becomes normal, especially when the diet is correct. So conventional treatment for high blood pressure, there are various tablets, drugs for controlling blood pressure. And don't forget that pharmaceutical drugs are the third leading cause of death because of side effects. So let's talk about these different drugs, conventional drugs for treating high blood pressure. Look at I mentioned about diuretics before, the side effects of diuretics like Lasix. So these are drugs being used to prevent edema, okay, due to the side effects of the drugs being used for monitoring the blood pressure. Now there's the one called beta blocker. These are the ones, ACE inhibitors. And don't forget, there are many more, but because of time, they cause a catalog of side effects. They are known for that. So this was done. This was what I found out with the federal drug that's FDA US, okay, FDA, and this was last year when they put out this note, blood pressure drugs, they had to recall because they're found to be contaminated with what should not be there. So again, imagine, I'm glad they're able to monitor that, but in here, who does that? Okay. All right, let me move on. Time now, because I have many slides to go through. So let's talk about the natural solution. See, now you've known what causes blood pressure. And now let's talk about how can we manage this blood pressure naturally, which is on the increase worldwide, not only in Kenya. So these are the natural approach. This fruit, as you can see, like this is pomegranate. I'm sure you've seen in the shops here. I've seen in the market here, in the shops as well. Pomegranate contains a lot of antioxidants, like polyphenol, is known to help with the blood platelet stickiness. You know, those the blood cells, part of the blood cell, this is the one that makes the blood so sticky, causing clot. Okay, they call them platelets. So this type of fruit is known to actually help, so you don't get increase in those sticky platelets inside the blood vessels. So that's pomegranates. So all these are natural prevention of or management of blood pressure. These are fruits that are known to contain a lot of antioxidants and very rich in antioxidants. You can see this is we'll be talking more about when we're talking about our products. So these are all available in the market here. We're very lucky in this country, unlike many other parts of Africa. And you can buy them fresh or frozen. Yeah. So these are all the things we're recommending. The macronutrients that people should be consuming. All this full of colors, antioxidants for good, healthy lifestyle. Very, very important. You can see them there. Use Mediterranean diet, which is highly recommended. These are the things you should be consuming on a regular basis. Okay, I'm sure many of you are aware of that. These are called a sinful food to be avoided at all time. Remember, they are full of fat. Imagine this sticky bacon. Imagine fat, and they are full of salt. I have too much bad cholesterol. That's bacon. It's definitely no if you are watching your blood pressure. If you have, if you have regular consumption of this type of food, so the advice is that beware, okay? And even if you don't have hypertension, also beware, because also if you don't have, if in terms of prevention, beware of this type of food. I call it simple food. You should limit the consumption of bacon in most places. Why? Because the studies have shown that suggested that it can increase your risk of developing certain cancer as well, apart from increasing blood pressure. So it's not only blood pressure, also cancer. These are the things. All this team food, they're full of salt. So you don't even know the type of fat. All this team food. Avoid team food. Consumption of team food. Sodium too high. So you might be surprised to learn that the supermarket, although these are pasta, those people don't like to. They buy ready-made sauces. Maybe they are making pasta to know that they are full of salt. Half of the sauce brand tested, according to Consumer Report, had 400 milligrams of sodium, even more per half of the cup. So if you are being diagnosed with an increase in blood pressure, you choose low sodium sauces or whip up your own salt-free version. Very, very important. I hope you're listening. We're not talking to the youngsters here. Only the youngsters in general, they have this on the market. They have what you call energy drinks. Okay, it's different from our own Forever Fab. Okay, so energy drinks, they are known to be popular among teenagers and young adults, according to research. Okay, and this is not recommended if you want to maintain good blood pressure. Okay, in addition to causing headaches, they can, because of all those things, all the things inside them, they can cause anxiety, diarrhea as well, dizziness. Energy drinks have been shown to raise Okay, now I need to move on. Can you control that, please, Catherine? Okay. So also they are known to contain high amount of caffeine. Okay, this is when we talk about caffeinated drinks and increase in blood pressure. So all these energy drinks, they are bad. Okay, high amount of caffeine, okay, can exceed the recommended daily dose. So beware. And all this now. So not only do drinks with added sugar contributes to weight gain. No, not only it can cause obesity, all these drinks, okay? I don't mention company's name, but you can see all these drinks on the high street, but they also affect the blood pressure, okay? Because they're full of a lot of additives. So according to one study, individuals who drink significant quantity of sugar sweetened beverages, they are at high risk of developing increase in blood pressure. This is why they are getting younger. They are getting younger because of the diet is wrong. They are consuming all these things they should not be consuming. Okay, too much sugar, too much, apart from obesity, too much additives, too much caffeine. Okay, so whether you are hypertensive or not, preventive measure is water. Water is the best. It's your best choice of staying well hydrated. That's my recommendation. Talking to the young ones, okay, drinking a moderate amount of red wine. Red wine is good because it's everything in moderation, okay? It contains a lot of antioxidant, like grapes and all that. It's long linked to lower risk of heart disease. However, if you are hypertensive, you should be careful to limit your consumption of wine to 1 or 2 glasses a day. No, small amount. Even I would not recommend it if you are hypertensive because it's a form of alcohol as well. So drinking too much of alcohol per day can raise your blood pressure. Too much alcohol. This is what I was talking about. We were talking about factors. People nowadays consume a lot of alcohol. So it's not only wine apart from that. But in this case, we're talking about wine. Take in moderation. So how to maintain healthy blood pressure? So again, how can you maintain it? Maintenance of healthy blood pressure. You have to make sure that, according to evidence, as you can see there, it's been linked to cognitive decline, which is on the increase when I mentioned about dementia, Alzheimer's disease. And so, as you can see, according to what we are trying to say here, to maintain a healthy blood pressure, it is important that you limit consumption of this highly processed food, which many people are consuming nowadays for convenience. They're not good because they are known to raise your low density lipoprotein, which is in the normal language known as a bad cholesterol. Okay. In many ways, bad cholesterol, that's low density lipoprotein, is the bad one. Okay, they can increase. Okay, so you have to limit the consumption of this processed food. Not say for convenience, some people they don't even have cooking pot in their household. They don't. They go and buy all those ready-made food. It's very dangerous. You don't know they contain all this cheap oil. Those ones that settles at room temperature, apart from too much salt. So avoid food, friend. These are the same limit. You don't say don't eat, but not making a habit of it. Okay, very, very important. Okay, these are all these processed meat. Imagine bacon as a sausage, which is the nation's favorite, especially in the evening. Those sausages, you see them, guys who selling or people selling sausages in the evening. So that's a regular consumption here. It's not recommended if you want to be a candidate for increase in blood pressure. Or dogs, all this salami. Can you imagine the amount of fat it contains? And also commercial baked goods like cookies in moderation, pastries, donuts. So again, you can see reducing too much excess of sodium, of salt. So it's very, very important that you should consume to what the amount of salt you're taking in your diet. Very, very important. I've already mentioned about the risk of taking too much, the association of too much salt with increase in blood pressure. Okay, so regular exercise is also very, very important. This is the good one. It's a high density lipoprotein. It's a good cholesterol. Very, very important to make sure you have increase in that and lower the increase of the bad ones. And also triglycerides is another part of cholesterol we're talking about. And improve how your body uses fat. Manage stress levels, very, very important. Remember I told you about stress, the common part of life nowadays. You need a bit of stress to get out of bed, especially when it's cold. But chronic stress is what we don't recommend, okay? But can you just wait, please? There's something I'm hearing. Hold on, just excuse me. Are you okay? What's happening? I'm missing. Our various, this is how to maintain healthy blood pressure, and you can read for yourself. Let's move on. So, nutrition solution. Let's talk about nutrition solution. We'll be talking about. Let's talk about that. So we have green tea. Green tea, according to research, is known to help to manage blood pressure. You can see a review of 25 different studies show that long-term tea drinking can significantly, we're talking about green tea here, not just ordinary tea, okay? It's known via consumption of it is been known to improve blood pressure. So this research was done, this study was reported in the British Journal of Nutrition. That was according to research. Green tea, and in our supplement, in our forever supplement, we have green tea, forever sun. Okay, so apart from consuming actually green tea itself, vitamin D is very, very important. We call it sunshine vitamin. We'll be talking more about that. Vitamin D supplementation can help to reduce blood pressure in hypertensive people. We mentioned about the importance of magnesium, which we'll be talking about more. Magnesium is a very important minerals. It performs over 300 bodily function. Okay, you can find them in when you're talking about food. You can find it in magnesium. They are known to be present in all these food: mushroom, apples, watermelon, and many more. So, as I said before, magnesium is very important when you're talking about the blood vessel to be dilated. Very, very important. Magnesium. So managing high blood pressure with forever. I hope you're all awake. All right. So you all know I'm not going to go through all this. You have trained on our aloe vera drink before, especially the aloe vera gel. So very, very important. We have 4 different types in Kenya at the moment. We've only got this one, and this is Forever Freedom. So we haven't had this for a long time. I don't know why it is being. Anyway, I want to go into that. So berry nectar, we haven't had it for the past 2 months. So I've been told that they're coming soon. So it's known as miracle plants. Very, very important to take aloe vera in order to manage the blood pressure, because it's food in a glass. I call it health tonic. Very, very important. It's got so many benefits in terms of making sure, remember I was talking about association of inflammation and the increase in blood pressure. So aloe vera is anti-inflammatory. So let me move on. So those are the things why it's very, very important, because it's well balanced with vitamins, minerals, and amino acid. Very, very important. And that's all the benefits of the aloe. As I said before, it's anti-inflammatory. It's very good for blood circulation and better absorption of nutrients. Don't forget, many people, they eat, they don't absorb. So just taking aloe will help for the nutrient absorption, and helps to, it helps to manage any form of allergic reaction. It's very good for metabolic disorders, which is on the increase nowadays. Promote internal balance. This is why I said it's a general tonic, health tonic. So another one which I recommend is our IG Plus, which I've been told that we'll be having it in Kenya very soon, I hope. So IG Plus is, you can see, it contains a lot of a blend of antioxidants, those colorful fruits, and vitamin complex. So it contains 5 grams of pure arginine, which is the amino acid. Okay, 5 grams. You see it per sachet. Okay, so what does it do? I'll go back to that later. But look at instead of taking all those all those, I'm not against conventional medication. As a complementary practitioner, if somebody's on medication, I never ask them to stop. Okay, so you can monitor them gradually. You recommend our products to remove the side effects of the conventional medications. Here we have is to explain how our products works. That's RG Plus, containing the small sachet containing 5 grams of L-arginine, the amino acid. How does it work in the body? This is the picture of the cross section of the blood vessel. You can see it's nice and smooth. Okay, you have the smooth muscle, then you have the inner one. There are 3 layers there. You have the inner one called endothelium. This is a very important area. So you can see it's nice and clean, like the one you get in a newborn baby. Innocent ones, nice and clean. So here, when you start to use our products like RG Plus, what does it do? It helps to dilate the blood vessels. You can see it's wider. So it does the same work as conventional drugs, but without any side effect. That's our RG Plus, because it contains nitric oxide. Very, very important. That's why it works. So this is the product. This is the product again, RG Plus, with all this antioxidant, pomegranate food, and all that. Okay, you can see it contains all the other vitamins, so vitamin C, vitamin D3. You can see all the components. Very, very important. Vitamin B9. All these things are all there in our special. That's what you call the unique blend of ingredients inside this RG Plus. So, and again, some people taking a watermelon. So there's another type of protein found in the watermelon, which converts this protein and nitric oxide, so that you get efficient blood flow. So this is why it is important. You can see all these components full of antioxidants. I normally recommend it to anybody who wants to manage blood pressure. Very, very important. And it does work. So you take one, inside this package, you have 30 of them. That's for a month. So, the small packet contains 5 grams of L-arginine. So we put it in a 300 mils of water during the day, not at night, because again, it releases energy. So you don't take it at night unless you want it for that special energy at night time. So you take it during the day, and very, very important in terms of balancing blood pressure. Very, very, this is why it's this is why we need it in Kenya. Okay, we need it in Kenya, knowing the statistic of people, 1 in 4 people being hypertensive. Look, so this was a study done on pomegranate. Okay, it's very, very important because it helps to help people with the increase in blood pressure. You can see. So that's the research, which pomegranate, as you saw, that fruit we contain within RG Plus. These are all these, and they're also anti-inflammatory, just the same as the aloe vera drink. You can see can also gives, it's actually higher than that of wine and green tea. So very, very important was the study done on the pomegranate. It's helps to manage your oxidative stress and get rid of all those free radicals. And again, this oxidation of those bad fats, okay, which can cause cirrhosis or plaque formation in the arteries. Okay, benefit of arginine, you can see that amino acid. You can see that this amino acid contained inside the RG plus. It changes into nitric oxide. Okay, it's a very powerful. Normally, the body produces a nitric oxide, but due to aging process and lifestyle, the nitric oxide gets depleted. So this is why we need to be taking supplements. Okay, so it's a very powerful neurotransmitter. What does it do? It helps the blood vessels to relax and improve blood to flow, as you saw in that picture. That's the work of the amino acid arginine. It may also help to, so it's not only, they help to improve blood flow in the arteries of the heart, okay? Very, very important. And it improves the symptom of clogged artery, as already said, by getting rid of those fatty deposits and all those, those pain in the chest, angina, and all this formation of, and the coronary heart disease. So this really helps. So it, as you said, this work of this amino acid here, which is a broken down of protein, L-arginine. So what does it do in the people? Because some people, they come to see me, they say they have problem with whenever they walk, they feel tired, they get the blood vessel is not flowing properly. You call it intermittent clausidation. So they are having issue because of blood. The blood is not flowing properly. They have a problem because of lack of this type of amino acid. So this is why I said that here is it helps to manage the blood pressure in some people and improve walking distance in patients with this type of issue, intermittent the cramps in the leg, okay, called intermittent clausidation. Very, very important. And so apart from L-arginine in RG plus, we also all this those fruits I showed you before. They contain a lot of antioxidant, powerful antioxidant called the resveratrol. So very, very powerful, and it's one of the most potent polyphenols to protect against free radical damage. okay, which can cause increase in blood pressure. So it helps to manage blood pressure, and again, it makes your blood vessel to function better. So as you see, it is known to increase the amount of nitric oxide in the blood, which is very strong. So in a way, it's a very strong vasodilator, which means it increases the size of the blood vessel to make sure the blood pressure is controlled. So this one is contained within the RG plus as well, apart from arginine. So another one to manage blood pressure from forever is the omega-3 fish oil. Everybody, we all need, we need this product. I know we don't have it at the moment, so popular that it's sold out. So we are waiting for another consignment of Arctic's omega-3 fish oil. So it's very, very important. It's a good fat, okay? And you find our product, there are no-nonsense products. A lot of research was done initially by Dr. Dieberg. Okay, so he did a lot of research on products, and we're also working with Eskimos. Eskimos they don't know anything about blood pressure because of their diet. The right type of fat, that's what they eat. So omega-3 fish oil or Arctic Sea is very, very important for anybody who's trying to manage blood pressure, or anybody who's been diagnosed with high blood pressure. Very, very important. So we recommend they take three capsules twice a day, a total of 6. So if you take it just before food or immediately after food. So those are the components. For those who are new on the platform today, I've already trained on this before. You can see the components. Ours is good. It's not like those other ones on the high street. Now you buy some. There's so many products on the high street. Some of them, they're not natural. And if something is not natural, you get the expensive urine. So look at the component of our omega-3 fish oil here. And we also added the vitamin E inside to prevent oxidation or to stop the oil from becoming rancid. Inside the oil, it's oil inside the capsule. So very, very important. And don't forget, as I said before, there's inflammation associated with increase in blood pressure. So it's also known to control inflammation. Very, very important. Also boost the immune system. So very, very important. Is as you can see there, found to manage the omega-3 is very important to manage blood pressure as effectively as other lifestyle changes, including exercise. So it's not only omega-3 alone. As I said before, all these things very, very important. They all work together. That was according to research by American Journal of Hypertension. So just imagine this, as I said, but just a repeat for you here. Look at the arteries, the main blood vessel. Can you see the deposit of those fatty deposits there? So after everything is cleaned out, look at now you're going to have reduced or balanced blood pressure. All these deposits is no longer there because of this supplement together with other supplements from Forever. This is what you call normal. This is how it should be in reality. So this is another one. I hope they're taking notes. Vitamin B12 plus, very, very important. That's our B12 plus in Forever. Thank God we have it. At the moment, the omega-3 is coming. They are coming soon. Okay, because the products are so good, they get sold out quickly. It's amazing, unlike other ones on the market. So here we have Forever B. Don't forget our products are supplements. They're well researched, scientifically researched. Some of them they take about 3 to 4 years of research before they're available for you to buy. So we should always be proud of Forever. There are no nonsense products. So our B12 plus is very, very important. It's not just ordinary vitamin B12. We say B12 plus because it contains other parts of the B vitamins, like you can see there, B1, B2, B3, B5, B6, B7, B9, and all this one. This is all the components of a B12 plus. So according to research or study, they've shown that B vitamins are very important as they are known to have a positive role when it comes to managing blood pressure, which can also be associated in making sure one does not become a candidate for strokes. So it helps to protect the heart by lowering inflammation, just working together with the omega-3 fish oil. And again, don't forget, there's this protein here. It's a dangerous one. We call it homocysteine. Again, depends on the diet. People consume a lot of meat, all those things. No, meat is acidic. and they are deficient in the B vitamins. So this homocysteine, according to research, has been associated with increase in over 60 different chronic diseases. That's associated with increase in the amount of homocysteine. I would like you to read more about it, because again, forever you need to read. If you don't read, you get rickets of the mind. So you need to read and find out what's Josephine talking about homocysteine. Okay, so this has been associated as increase in homocysteine is be associated with increase in blood pressure. So here we have the solution together with other supplements I'm talking about today. So this can help to manage the amount of homocysteine in the blood. So this is another vitamin very, very important. Vitamin D, supplementation again. We're not talking about micronutrients from Forever Living products. Vitamin D supplementation can balance the blood pressure in people with people who have been diagnosed with blood pressure, and also in the not only that, also it's also help. It also help in those who are now, they don't want to become a candidate for increasing blood pressure. I take vitamin D myself, the supplement absorbent D. You can see those are products which are known to contain vitamin D, like Algae Plus, Vitalize for Men, Calcium, Forever Daily, Forever Kids, Imu Blend, and our recent one, we call it Forever Absorbent D, which call it Sunshine Vitamin. You can see the tablets there. I take to on daily basis, especially being black. Okay, if you are black, your chance of absorbing vitamin D from the sunshine is less, unlike other races. And so these are the things. These are the supplements from Forever containing vitamin D. Okay, so I'm rushing because of time. Garlic thyme is also another one which is highly recommended. So garlic is very, very important. Why is it important? Because it contains a lot of sulfur, amino acid, and very powerful antioxidant, and tons of vitamins and minerals. So some people, sometimes when you recommend garlic, some people say, "Oh, I'm already taking garlic in my food." They don't know that it's not. They're just using as a food flavoring. But while the most powerful antioxidant, which they call allicin, is being destroyed. Okay, analysis is a component. It helps to reduce blood pressure. It helps to manage blood pressure. I'm trying to watch the words I'm using. Okay, because of compliance team, and also making sure your heart is working properly. I need to sort of remove all those. So it helps to manage cholesterol, those bad cholesterol naturally, and it's also a blood thinner. So that's another you have to be careful. Both. Our Arctic Sea omega-3 is the blood thinner. Okay, so if somebody is a warfarin, don't recommend it, or heparin, or any of those blood thinners. You have to be very careful, especially again if they are going to surgery. You don't recommend it, so that they will reduce. So it will reduce bleeding time. So be careful when you're recommending some of this. You need to ask your people, your customers, or your patient a lot of questions before you start recommending some of these products. Okay. They're good, but at the same time, ask many, many questions. As especially, I always want to know, what medication are you on? Very, very important, especially if they're on all those blood thinners, warfarin, heparin, and other ones, which are, you have to be careful. So for me, I ask so many questions so I know what to recommend. So in the Journal of Pharmaceutical Science, studies result that garlic work better than those blood pressure tablets. These are this is a very popular one, without any side effect of dizziness, constipation, lack of energy, and most of these ones for blood pressure, they're also known is associated with erectile dysfunction. I hope you're listening, guys. So that was our garlic from Forever Living products. Contains odorless garlic, contains a lot of antioxidants, and it will help to relax the blood vessel, working together with omega-3 fish oil. Very, very important. And you only have to take 3 capsules twice a day, just before food, immediately after food. So I normally take them together when I'm also taking omega-3 fish oil. I don't, God forbid, I'm not hypertensive, but I'm trying to make sure my blood pressure is balanced. So we have Forever Daily here, Forever Daily from Forever. You can see all those ingredients there. So it's all bonded with aloe vera. All these natural macronutrients contained within this our Forever supplement called Forever Daily, which is a blend of over 55 nutrients. We're talking about vitamins and minerals. Some vitamins and minerals, they work together synergistically. So you can see contains a lot of natural phytonutrients. A lot of these very, very important forever daily. All they're very, very important. It contains both all these things. They are very, very important in managing blood pressure. It also contains magnesium, as I mentioned before, which is a chelated. It's formulated with the chelated minerals. Sorry, I forgot to turn on my phone. Sorry. Sorry. All right. So magnesium, as I said before, the one we have in Forever is a special one. It's a specific form of magnesium, called it magnesium biglycinate. Very, very important. It's different from magnesium oxide contained in a nature mean. This is very, very important because it's a help to relax the blood vessels, support healthy blood circulation, and naturally assist in balancing good blood pressure. Very, very important. What we do, we take 1 tablet twice a day. That's our forever daily. Just highly recommended. Another one, I hope you're taking notes. This Immublend, which we don't have at the moment. I'm campaigning for company to bring it back. Immublend. Because again, your blood pressure is also associated with the immune system. You know, your immune system is your inner doctor. So if your immune system is working properly together with your digestive system, which also, don't forget, 80% of your immune cells are based in the gut. So if it's everything balanced, you're going to have good balanced blood pressure. So Immublend is formulated to contain this vitamin C, vitamin D, and zinc. And additionally, it contains mushroom, maitake and shiitake mushroom, very, very important in balancing blood pressure. Okay, let me move on. You can see there all you can see all these mushrooms, the most two important mushrooms here, very important for immunity and cardiovascular function. So the vitamin D3 is also good to strengthen the immune system. All these are very, very important for immune health. So you can see all those sort of things to balance the gut bacteria. Very, very important. I'm not going to emphasize too much on that because of time. So Lycium Plus is also another one from Forever. At the moment, we don't have it, but I hope it's on its way. Lycium Plus, not just only Lycium, which is from a food called Lycium barbarum. To enhance the potency of the Lycium, we've added the licorice. You know, this is another thing that people, if you go into literature, they say, don't take Lycium Plus, don't take it for Lycium because it contains licorice. Because licorice, it increases blood pressure. Now, with Forever Living products, intentionally, Forever trees with scientific research, they have removed what causes increase in blood pressure in that licorice. So as you can see, ours is we have removed glycyrrhizin from the licorice. So anybody who is having issue with blood pressure, they can still take our Lycium Plus. Because what causes increase in blood pressure, according to Forever scientific research, we have removed the glycyrrhizin. So this is a very important message because some of you may be going and reading, oh, you can't recommend it. No, it is a Forever Living product is different. I also contain this powerful antioxidant called quercetin, which is a biflavonoid, which is we find in wine and all these apples and all that. Very important antioxidant, quercetin. And look at this. So this is why I put red asterisk there. This is also important when talking maintenance of blood pressure. Part of ingredients is got maritime pine extract contained within this supplement, and it's very, very important to balance blood pressure and also help with to limit the formation of that plaque. Okay, very, very important. If you read about this oligo and I don't want to be too scientific for you because I want to make it simple. We call it OPC. This is part of the component in our Forever Lycium Plus, which help to manage to make sure you don't become a candidate for high blood pressure, and those also who are having issue with blood pressure to help them to manage it so it becomes normal. So importance of good bacteria. I remember I was talking about the gut digestive system. If your digestion is not working properly, it's going to affect a lot of things. It's going to affect, you're going to have increase in your blood pressure. Inside your digestive system, which I think I'll be talking about it in another day when we talk about toxic colon. So within your gut, you got to have you got to have balanced gut flora. You know, in your digestive system, you have the bad bacteria, you have the good one. Okay. The only factory to get until people start taking antibiotics. So imagine healthy adults, they have about 2 kg of bacteria, good bacteria in their system. Okay. They're very good. They're housekeepers for these are housekeepers for the gut. And they take part in digestion and absorption of our food. They also know to produce a number of enzymes which breaks down protein. That's just the importance of this beneficial bacteria. Protein, carbohydrate, fiber, and fat. They're very good. They produce various substances which transfer vitamins, minerals, and other nutrients. Receive from the food we take, and also supplements. These are, I'm just talking about general, the beneficial effect of good bacteria within the digestive system, especially in the colon. Those bacteria, they're very, very important. You remember, as I said before, they produce what you call butyric acid, also very important when you talk about brain health and blood pressure. So I want to keep it simple. This is a Forever Pro B. That's we call it Forever Active Pro B, which is a special one containing 6 beneficial bacteria, and it's well scientifically researched. Why I put this one here? Normally, for a healthy gut, we're not supposed to have the ratio of good. The ratio should be 85 to 15. This is the ratio of good bacteria, and this is the ratio of bad ones. But nowadays, because of bad diet and lifestyle, it's been reversed. This is why with the nation, we are sick. So Forever Living Product Active Pro B can come to the rescue in terms of balancing the population of those beneficial bacteria. So you take one Pro B in the morning. You can take with your aloe or with water. Very, very important for digestive system. You remember it's also good for many other things, but because today we are talking about blood pressure, so I just want to talk about the benefits of Pro B for blood pressure, the good one. So, but if somebody is symptomatic, if somebody has been diagnosed with certain health issue, they need to be taken in the morning, also at night. So that means 2 a day. So again, remember we're talking about obesity. Obesity, the association of those obesity with the increase in blood pressure. Body weight, body fat is not good. You see so many, especially guys carrying around all those visceral fat. Okay, very, very, and too much weight. Too much weight is not good, as I already mentioned, causes increase in blood pressure. So in order to, one of the products we have in Forever for weight management to manage that amount of weight, which can cause increase in blood pressure, is we have Forever detoxification package, which is our Forever C9. I'm not going to talk about that. I just mentioned it. So very, very important to detox. There is a detox. Don't worry. It's not a weight reduction. It's to detox, remove all those toxins within the system. And again, now to make sure, some people, they say, okay, when you're on it, you lose a bit of weight because your body is liberating those toxins. That's why you see a reduction in weight that has been accumulated over the years. Okay, the proper weight management is our Forever F15. So for those who are obese, they've been told that they need to manage their weight. This is highly recommended after our Forever C9 program. Call it Forever F15. Just remember that. So managing stress, we don't have this at the moment. It's part of the products in Forever. They call Aloe Herbal Tea, Aloe Blossom Herbal Tea. It's a caffeinated, non-caffeinated, does not contain caffeine. Don't forget that. No non-caffeinated tea. It helps to calm down body and helps against increase in blood pressure. Very, very important. You take one packet in a 50, have a liter of water, hot water. You can even drink it cold if you want. It's got lovely, lovely aroma. Hey, I love the smell because of all these spices which are brought from different parts of the world. It calls chamomile, which is very good anti-stress. All these things, very nice. So it's well known to be able to manage stress, especially in the evening, take in the evening. So another method for blind. Okay, we are getting to the end of the presentation now. So lifestyle changes is very, very important. As already mentioned, eating healthily, well-balanced diet. Again, query, I've already spoken. Adopt Mediterranean diet, very, very important. Avoid packaged food. We've already mentioned about that, like processed food with a lot of trans fat. These are killers. And use antioxidant spices in your cooking. In my cooking, I use a lot of spices. It's amazing. It's good. I use turmeric. I use ginger. I use garlic. I use onions. It contains, especially here we are lucky in Canada to have red onions. Contains a lot of quercetin, those special antioxidants. Pepper, why not? Pepper is very good to manage your blood pressure. Pili pili. If I don't eat pili pili within a day, I go sick. So it's part of my food. Not too much, but everything balanced. There's a special one that I buy in the market. They're imported from Congo. Okay, they call it bonnet pepper. So very, very important in terms of managing blood pressure. And you use your food, you're full of antioxidants. Avoid refined sugar. I know in this nation, we some people, when they want to drink teas like syrup, they put so much sugar. Sugar is an oxidant. So try to manage the amount of sugar you're consuming. The deadly ones is the one with the high street, called high corn syrup. No, those ones, you find in all those drinks at the high street, they are dangerous. Very, very dangerous when we're talking about maintenance of good blood pressure. Artificial sweeteners, avoid them. You can use stevia. I know it's got funny bitter aftertaste, but those artificial sweeteners, they are also be associated with increase in blood pressure. Consume a lot of appropriate food supplement. I said appropriate food supplement from forever. We've already mentioned about the amount of salt, because too much salt can cause increase in the fluid retention, which can affect your body's electrolyte balance. Okay, this is very, very important. You can take, I think I mentioned somewhere the amount those pink salt, and again you can those potassium substitute, okay, for instead of the real table salt. So very, very important to make sure that you're able to maintain even we call it edema, so you don't develop edema. Okay, fluid retention. So avoid MSG. Remember, monosodium glutamate found in those food enhancer. Okay, which is very popular here. Reduce. You can because people they consume a lot of this. You can see one in 4 Kenyans is hypertensive. Because it's what they here in this nation, they consume too much of this. It's not necessary. Instead, use a lot of spices for your food. Reduce alcohol, caffeine consumption. Recommend it. Very, very important. Okay, stop smoking. It's important to manage your weight. Relaxation technique. According to research, yoga can help. Meditation also. And it's very, very important. Especially I'm talking to guys here on the platform today. I hope you are listening, because you are the way guys are known to not to go for medical checkups. You can MOT, regular checkup, yearly medical checkup, very, very important. Don't wait until something gets out of hand. These are guys, they tend to internalize a lot. So we women, we are very good in making sure that most women, not all women, to go for regular medical checkups in case there's something wrong, can be corrected on time. So water is very, very important. Water is life. Why is water important? Because for blood composition, ensuring the correct nutrients is very, very important. Ensuring correct nutrients reach each vital organ. So we recommend a minimum of 2 liters a day. But for the guys, we say 2.5 liters a day. You don't gobble it every day at once. For me, I sip water. As you can always make sure you have it and you sip it. So water a day. Again, with my RG plus, I still count it as part of the fluid intake on daily basis. So I hope you are following. Exercise is very, very important. You can see here, like you don't have to go to the gym, okay? You can just basic exercise, gardening, walking, brisk walking, cycling, aerobic exercise. Very important, increase oxygen. You need oxygen flow to maintain good blood pressure, okay? Which is what RG also does, increase oxygen flow within the blood vessels. So that's a very, very important exercise. So we've mentioned about meditation is very good to calm the hormone called serotonin. Okay, it slows down the heart rate, induce positive thought, and lower blood pressure. Okay, help to manage blood pressure. So, but meditation alone will not help those with high blood pressure or those with pre-hypertension alone will not, okay? But there's so many other things that I've already mentioned. However, meditation in conjunction with other positive lifestyle changes can help. So this is what according to my research, they said during that act, people, they release the endorphin, which is a very calm, it helps to manage the blood pressure. Okay, so research suggests a link between sex and lower blood pressure. This effect can be because of calming all this, the effect of serotonin in the brain, calming brain chemicals released after sex for both parties. For both parties involved, including serotonin, oxytocin. These are all hormones for calming blood pressure. Okay, vasopressin, and again, not to mention what we were talking about, nitric oxide, and also prolactin. These are hormones, very, very important. Prolactin is a hormone, oxytocin is a hormone, serotonin is a hormone, very, very important for maintenance of good blood pressure, which they said is released during the act. Okay, very, very important. So lifestyle this is the elimination diet. Remove anger, very, very important. Like I showed that picture of road rage, regrets. No, forget. Nobody is perfect. Don't live regretting this. Just move forward. Worry, resentment, guilt, blame. No, those are things that can increase in blood pressure. Very, very important. That's according to Charles Glassman. Very, very important. You call it to help to manage blood pressure. I hope you follow. So thank you very much, ladies and gentlemen on the platform today. I have come to the end of my presentation. Asante sana. And if you have any burning question or burning issue, please, you are free to ask question now. Catherine, are you there? Or